Hi, and welcome to William Patterson Student Training on Strategies for Preventing COVID-19 Exposure. This training was developed using the guidance from the Office of the Secretary of Higher Education. All the information in this Prezi is from public health agencies, which include the World Health Organization, the Centers for Disease Control and Prevention, the American College Health Association, and the New Jersey Department of Health. The policies and procedures that will be discussed can all be found in the WP Reopening Plan, which will be referenced often in this presentation. William Patterson is carefully planning for a return to on-campus teaching and residence life for the fall 2020 semester. The university has developed a comprehensive plan based on guidance and standards provided by the Office of the Secretary of Higher Education in concert with Governor Phil Murphy's state reopening plan. The university will follow all state and federal guidance regarding best public health practices and seeks to ensure a safe and healthy work and learning environment for its students, faculty, and staff. This presentation is based on the reopening plan and public health guidance. For more detailed information, please read the reopening plan. William Patterson is committed to minimizing the risk of COVID-19 within our community. In order for us to reduce the risk of transmission, we are all expected to adhere to the public health practices described in the Pioneer Pledge. We all have an ethical, personal responsibility to ensure that we are following the latest recommendations and protocols. By acknowledging receipt of this policy, you agree to adhere to the new protocols for returning to and/or coming to campus. You acknowledge that these protocols may be updated as information and guidance evolve, and that you will adhere to any such revised protocols. As a WP community member, you understand it is your responsibility, to the best of your ability, to promote and adhere to these public health initiatives and procedures. Let's watch this video developed by the World Health Organization to review the facts about COVID-19.
Some of the early cases had reported visiting or working in a seafood and live animal market in Wuhan. Investigations found that the disease was caused by a newly discovered coronavirus. The disease was subsequently named COVID-19. COVID-19 spread within China and to the rest of the world. On 30 January 2020, the World Health Organization declared the outbreak a public health emergency of international concern. In this video, we'll take a quick look at what is currently known about COVID-19. Keep in mind that this is a new disease, and what's known is rapidly evolving and might change in the future. So what is a coronavirus? Coronaviruses are a large group of viruses. They consist of a core of genetic material surrounded by a lipid envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause illness in animals and humans. In humans, coronaviruses can cause respiratory infections ranging from the common cold to more severe diseases. These include the severe acute respiratory syndrome coronavirus, first identified in China in 2003, the Middle East respiratory syndrome coronavirus that was first identified in Saudi Arabia in 2012, and SARS-CoV-2, the name of the virus that causes COVID-19 that was first reported in December 2019. So, where did this new virus come from? It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from animals to humans. This is called a spillover and could be due to a range of factors, such as mutations in the virus or increased contact between humans and animals. For example, MERS-CoV is known to be transmitted from camels, and SARS-CoV from civet cats. The animal reservoir of the new coronavirus is not known yet. How does the disease spread? The disease can spread from person to person through droplets, when an infected person releases those droplets through coughing, talking, or sneezing, for example, when close to another person. It can also spread when infected droplets land on objects, and when another person touches them and then touches their eyes, nose, or mouth. What are the symptoms? The incubation period, which is the time taken from exposure to the virus and development of symptoms, is on average 5 to 6 days, but can range from 1 to 14 days. There can be a range of symptoms, from very mild to severe. Some people may not develop symptoms. Common symptoms include fever, fatigue, and respiratory symptoms such as cough, sore throat, and shortness of breath. Some people reported loss of their sense of taste or smell, and some may develop a skin rash. In more severe cases, there could be pneumonia, organ failure, and sometimes death. About 80% of cases recover from the disease without needing special treatment. But there are some people who are at risk of serious illness. They include older people or people with underlying medical problems, such as chronic respiratory disease, obesity, diabetes, high blood pressure, heart disease, or cancer. How can we tell whether someone is infected? The infection is commonly diagnosed by a test called reverse transcriptase polymerase chain reaction, generally known as PCR. This test identifies the virus based on its genetic fingerprint. There's also a blood test that can check for antibodies against the virus, which may show that someone was infected in the past. How is it treated? The treatment for COVID-19 is mainly supportive care. Medicines against the virus are currently under investigation. How do we prevent transmission of the virus? There are a number of effective ways to prevent the spread of the disease. These include covering your mouth and nose when coughing or sneezing with a flexed elbow or tissue, and throwing the tissue in a closed bin immediately after use. Wash hands regularly with soap and water or an alcohol-based hand rub, maintaining at least 1 meter distance from people, and the appropriate use of masks and personal protective equipment, especially in health settings. It's important to stay home if you're feeling unwell and to call a hotline or your medical professional. But if you have a fever, cough, or difficulty breathing, seek medical care early and share your travel history or contact with someone unwell with your healthcare provider. In some areas, governments have implemented specific physical and social distancing measures to prevent the spread of the outbreak. It's important to follow their advice. Vaccines to prevent COVID-19 are currently under development, and scientists around the world are working hard to make this happen. That's a quick look at this emerging infectious disease. We're still learning about this virus every day, and what's known may change. So please, check the website below for the most up-to-date information.
In the next slides, we will reiterate a few of the points from the video you just watched. People with COVID-19 have had a wide range of symptoms reported, ranging from mild symptoms to severe illness. Symptoms may appear 2 to 14 days after exposure to the virus. People with these signs and symptoms may have COVID-19. This list is not all-inclusive. Other less common symptoms have been reported, including gastrointestinal symptoms like nausea, vomiting, or diarrhea. Look for emergency warning signs for COVID-19. If someone is showing any of these signs, seek emergency medical care immediately. Again, this list is not all possible symptoms. Please call your medical provider for any other symptoms that are severe or concerning to you. If you are on campus, you can call the Counseling Health and Wellness Center to discuss your concerns. It's especially important to get tested if you are experiencing symptoms, you've been in close contact with someone who tested positive for COVID-19, if you are an essential worker, if you were recently in a large crowd where social distancing was hard to maintain, if you've recently traveled to an area or a state with high COVID-19 infection rates. All students must report exposure or diagnosis of COVID-19 to the Counseling Health and Wellness Center. If you test positive or negative for COVID-19 on a viral or an antibody test, you still should take preventative measures to protect yourself and others. We do not know yet if people who recover from COVID-19 can get infected again. Scientists are working to understand this. Testing is recommended for symptomatic individuals and for certain populations such as athletes, first responders, and prior to clinical placement. Testing sites have various operating hours and requirements. We encourage you to visit the New Jersey COVID-19 testing link to find out more about testing. Testing will be offered for students that are exposed or symptomatic through the Counseling Health and Wellness Center. All members of the William Patterson community, students, faculty, and staff, will be required to participate in daily, self-administered health screenings and temperature taking. Anyone who reports symptoms or a fever of over 100 degrees Fahrenheit will be referred for testing. This health screening will be a web-based form and will be required prior to arrival on campus, leaving a residence hall room each day, arriving at any clinical or teaching placement or any internship program, or participating in any other university activity or gathering. All positive health screenings or temperatures over 100 degrees Fahrenheit will be forwarded to the Counseling Health and Wellness Center. All information will be kept confidential in adherence to federal and state HIPAA guidelines. Local health officials will be responsible for contact tracing. To assist local health officials, anyone diagnosed with COVID-19 will be asked to fill out a contact tracing form. Contact tracers are calling with life-saving information that will keep you, your loved ones, and your community safe and healthy. When a New Jersey contact tracer calls, it's because you tested positive for COVID-19 or have been in close contact with someone who has, so it's critical that you answer the phone. Contact tracers will reach via phone, text message, or letters dropped off at your door. Contact tracers will provide their name, agency, and a phone number. If you have any doubts about the legitimacy of your conversation with a contact tracer, you may hang up and call your local health department. You should also feel free to request the name and ID of anyone who calls. The following are key prevention strategies. Keeping space between individuals is one of the best tools to avoid being exposed to the COVID-19 virus and slowing its spread. Since people can spread the virus before they know they are sick, it is important to stay away from others when possible, even if you have no symptoms. Social distancing is important for everyone, especially to help protect people who are at a higher risk of getting sick. People on campus should follow these social distancing practices. Maintain a minimum of 6 feet of space between people whenever feasible. Do not gather in large groups. When in a meeting or gathering, ensure that the room used allows for adequate distancing. Stay out of crowded places. Keeping your circle of close friends and family small will minimize risk of exposure. You can help yourself and your loved ones stay healthy by washing your hands often, especially during these key times when you are likely to get and spread germs. Before, during, and after preparing food, before eating food, before and after caring for someone at home who is sick, before and after treating a cut or wound, after using the toilet, after blowing your nose, coughing, or sneezing, after touching an animal, animal feed, or animal waste. Washing your hands is easy, and it's one of the most effective ways to prevent the spread of germs. Clean hands can stop germs from spreading from one person to another and throughout an entire community. Washing hands with soap and water is the best way to get rid of germs in most situations. If soap and water are not readily available, you can use an alcohol-based hand sanitizer that contains at least 60% alcohol. You can tell if the sanitizer contains at least 60% alcohol by looking at the product label. During the COVID-19 pandemic, you should also clean hands after you have been in a public place and touched an item or surface that may be frequently touched by other people, such as door handles, tables, gas pumps, shopping carts, before touching your eyes, nose, or mouth, because that's how germs enter our bodies. Face coverings must be worn by all persons on campus when in the presence of others, within 6 feet, and in buildings in non-private enclosed settings. Appropriate use of face coverings is critical in minimizing risk to others, as a person could spread COVID-19 to others even if the person does not feel sick. Note that the face covering is not a substitute for social distancing. When putting on the face covering, wash hands or use hand sanitizer prior to handling it. Ensure the face covering fits over the nose and under the chin. It is required that both the nose and mouth be covered. Situate the face covering properly with nose wire snug against the nose. Tie straps behind the head and neck or loop around the ears. Throughout the process, avoid touching the front of the face covering. When taking off the face covering, do not touch your eyes, nose, or mouth when removing it. When taking off the face covering, loop your finger into the strap and pull the strap away from the ear or untie the straps. Wash hands immediately after removing. Keep face coverings stored in a paper bag when not in use. Cloth face coverings may not be used more than one day at a time and must be washed after use. They should be properly laundered with regular clothing detergent before first use and after each use. People do not need to wear goggles or face shields as part of general activity on campus. Good hand hygiene and avoiding touching the face are generally sufficient for non-healthcare environments. These will be signs that you will see when you arrive on campus. The university is committed to sustaining a safe campus environment by continuing to monitor and assess potential and actual COVID-19 spread. Review existing policies and procedures to ensure effectiveness, disseminate and adhere to existing and updated public health directives, and adjust restrictions and reduce on-campus staffing as needed. Prevention reminders will be posted throughout the campus, as well as signage for new ways to navigate our campus to ensure our safety, such as single occupancy elevators, entering and exiting from different doors. In an effort to provide a clean and disinfected learning and working environment, the university's custodial team has implemented additional cleaning processes to assist in minimizing exposure to COVID-19. Across the campus, hand sanitizer dispensers will be located at building entrances. Structural barriers such as plexiglass sneeze guards have been installed where needed to maintain social distancing. HVAC systems in all buildings have been serviced and filters have been upgraded and will be changed more frequently. Instructional areas, common areas, and restrooms will be disinfected daily. All areas will be cleaned using CDC recommended disinfecting and sanitizing sprays, cleaners, and wipes. Spray bottles with an EPA-approved disinfectant spray solution to eradicate the COVID-19 virus are being provided in classrooms and lab spaces for occupants to use for disinfection needs in between classes. Anyone entering the room can use the solution to disinfect the area prior to occupying a seat. No assumption should be made that the previous occupant cleaned the space prior to leaving. Restrooms will be maintained approximately twice per day with additional cleaning in high-traffic bathrooms and for any incident requiring attention. All sinks and toilets will be thoroughly cleaned and disinfected. All surfaces will be wiped with a disinfected solution. Door handles, stall locking mechanisms, and mirrors will be wiped down and disinfected. Residential custodial staff will clean common spaces daily. This includes wiping down high-touch surfaces, emptying garbage, cleaning floors and furniture, and cleaning public bathrooms and lobby areas. In your living space, you should use a household cleaning and disinfectant product like Lysol, Mr. Clean, Pine Sol, Windex. They are adequate to kill bacteria and viruses. Wash sheets, towels, and other linens using household laundry detergent and dry in a hot setting. Eating utensils should be washed either in a dishwasher or by hand with soap and water. Use lined trash cans. Place used disposable gloves, face coverings, and other contaminated items in the lined trash cans. To minimize exposure, the university has developed a visitor policy. All visitors, including those visiting students that are invited to campus, are required to adhere to state and local laws and university health policies to ensure the safety of our community. It is recommended that institutions limit visitors to the best of their ability in order to reduce the risk of exposure. Having visitors on campus poses challenges for contact tracing and quarantining procedures. In order for us to reduce the risk posed by visitors, WP has established protocols for which all hosts are responsible. They include: the host is responsible for explaining to the visitor the new procedures that have been established at WP in response to COVID-19. All visitors must wear facial coverings while in the presence of others. All visitors must participate in a self-administered health screening, including a temperature check prior to their arrival on campus. If someone has a temperature of over 100 degrees, they must stay home and not visit our campus. All individuals that invite a visitor to campus are required to fill out and submit a visitor log via web-based form on the same day the individual visits. Please read more in the WP reopening plan. Visitors are not permitted in the residence hall at this time. To save lives and prevent the spread of COVID-19, the state has issued an incoming travel advisory that all individuals entering New Jersey from states with a significant spread of COVID-19 should quarantine for 14 days after leaving that state. This includes travel by train, bus, car, plane, and any other method of transportation. An updated list of states that meet that criteria can be found on the New Jersey COVID-19 website. All William Patterson-led study abroad programs and student exchange programs have been canceled for fall 2020. Students may defer their programs to spring 2021 if available or as changing public health and travel regulations allow. Students planning to participate in third-party study abroad programs not run by William Patterson are urged to consider delaying participation. Students should consult information available from the CDC and the U.S. Department of State prior to making any financial commitments to such programs. The university's Office for International Students and Scholars is prepared to assist students in locating information that will help inform their decision. The impact of COVID-19 is far-reaching. Many in the WP community have been personally affected. There are resources to maintain one's mental and emotional well-being, as well as emergency assistance. Counseling services are available for our students through phone or video conferencing and pre-screened in-person visits. Please continue to visit William Patterson's pages for the reopening plan and for updated information on COVID-19. Remember that information is evolving rapidly. Stay informed. Thank you very much. Wishing you a healthy start to fall 2020.